What is up, YouTube? Today, we're going to talk about another great career option called the community health worker. Community health workers are trained in kind of the public health arena to bridge the gap between communities, healthcare, and state departments. So I'm on here on the CDC, the Centers for Disease Control website that gives you a little bit about the community health worker. There's training and education here. There's lots of community health resources. So, what could you be doing as a community health worker? Promotion with fat cholesterol, maybe a promotion with a community that speaks another language, or maybe working with diabetes control. Maybe it's transportation services, or maybe it's medication control. So you're kind of working in between those middle gaps. You're not necessarily the medical team, but you're that person that they trust, that you can assist and help in the community, fill in those needs in some gap areas. So maybe there's transportation need in your area. Maybe there's the cost of medication. Whatever organization you're working for will give you those resources. Now, we'll talk something about what do you need, the background, a career. It's really not about degrees. It's really not about certifications. It's really about helping people. So if you've helped, you've been a home health aide, an attendant, you've done something like this in your family, or you have a career or background, this might be for you. So I'm just going to play a quick video by a Department of Health that kind of really does explain what a community health worker does. And then we'll talk about how you could find these jobs in the community and facilities, face to face, remote, lots of opportunities as a community health worker.
A community health worker is basically someone that is trusted by the group that they work with and has a lot in common with them, kind of is able to identify with them and knows where they're coming from so that you can hook them up with needed services that will impact their health in a positive way. The role for community health workers is just coming into being, and there's an under-realization of all the roles that they could fill. The idea was to embed a community health worker right in the clinic so that we weren't just referring people to agencies around town, but that I would be right here to work with them directly. Typical things you might see that come to the surface are a patient isn't taking a medication because they can't afford it. A lot of times what I find when I really sit down and start visiting with people is there's much more to the picture than that. You know, maybe they're having trouble getting to the pharmacy to pick things up. You really need to be knowledgeable about all of the community resources that we have available to people.
I have been working at the Asian Center since 2009, and I started working as community health worker in July. At the Asian Center, we serve over 1,000 per year. As a community health worker, I educate them you should have a physical checkup to preventive care. They should know about diabetes. If they already have a diabetes, they should know how to control their blood sugar. When I know they would like to see a doctor, but they don't have insurance, I know some resources. I will refer them to People Health Center.
There's so many different terms, so many different titles for community health workers that some might be using Navigator, another might be using Health Educator.
There are too many people with different names who help the community, and they don't call themselves community health workers, but really they are community health workers.
A lot of times people tend to think of the term as someone that works with a traditional minority group, speaks another second language other than English, but every group has needs to be linked up with services.
Key things are listening skills, the ability to advocate on behalf of an individual, helping them to give voice to the things that they need in the community.
We learn about them, about their lives. I know her, so I know I have to be very patient with her and I have to be sure that she uses her insulin.
I think it's important as a community health worker to really be a part of the healthcare team, integrate in with the doctors and the nurses. One of the things our clinic has is a diabetic educator, so we work closely together. I think that really helps maximize what we can offer and increase the quality of care for that person.
I think community health workers are very important for the communities because we are the bridge or the key to find out more about the community or the client, what is in the hospital or doctor's clinic.
I think to be a good community health worker, it isn't really about a degree or formal training as much as it's about your communication skills. A lot of that is listening skills.
Many Vietnamese people, they come here after I help them, they say, oh, we're very lucky to have an Asian center here. If we don't have her, we don't have Asian center in Lincoln, we don't know where we can come for help.
I think that's really the essence of a community health worker, is taking the people and connecting them up to all the resources that are in our community.
It's a huge piece for individuals who haven't had a voice in our community in the past and now do have a voice.
My name is Maria and I am a community health worker.
My name is Pai Pai. I'm the interpreter and the community health worker.
My name is Mariana and I'm a community health worker and a health coach.
My name is Ha. I am a community health worker.
My name is Dion and I'm a community health worker.
So as in the video, you see community health workers do a lot of things, from health coaching to helping with transportation, getting people to point A to point B, using translation services, telling people where they can get resources that your organization works with. There are also remote community health workers as well. As you see here, you don't need that experience minimum here. Lived experience, including a combination of cultural background, health conditions, maybe working with a family member where you've tried to assist them or had to help them in care. So as you see here, maybe working in behavioral health, you've had that background before, but it's really not about the degrees. It's about listening. It's about helping people, bridging that gap in the community. So let's see what others we have. We also have other remote healthcare worker. And again, doesn't require, maybe you're going to be helping somebody navigate a system, as we see here. Within the scope of practice and training, navigate, you're not going to be providing medical care, but you're going to be providing services, information to people, albeit in a community or a remote environment. So we also have other community health workers. You see anywhere from $18 and $19 an hour in some instances. In other areas, you can make more money depending on what you're going to be doing. Maybe you're going to be working for an organization like Humana. So what does Humana require? 2 years of experience, maybe working with some sort of community agency. Maybe you've worked in a residential care, an adult daycare center, community health. Maybe you've worked in an organization that was a religious organization that dealt with the community or church. Keep in mind, if you're working with the community and you're working with people, this definitely could be the type of job for you. Here, this is working for Humana, conducting in-person assessments. Maybe you're going to be going from a location to individuals' homes, or maybe you're going to be going to a potential care center. Must have the ability to have a VPN. They even have, for this particular one, if you're not vaccinated, that you undergo consistent testing. So there's such a need for this that they are willing to work with people. And again, healthcare companies, group organizations, jobs. So maybe if you've had some sort of case management experience, or maybe you've worked in the medical field before, this particular one is offering a sign-on bonus of $1,500. So keep in mind that these are all over. There's different locations. You may work for a care center. You may work for the state. it gives you some flexibility to really go out there and help the community. 1 year experience working for nonprofit or public health or customer service. So if you've worked with people, if they're not requiring any special type of certification, if this is something that you could do, making about $20 an hour, it looks like in most areas. Let's take a look at the salary and see what we come up with. Okay, here's our ONED website that tells us about community health workers. Remember, this is sponsored through the Department of Labor. So through different states and different areas and locations, they've gathered information. As they mentioned before, it may be different names. So you might see community health program, community health navigator, community health promoter. It may be under HIV counseling or testing services. So there are all sorts of community gaps for diabetes, heart disease, food and nutrition programs, elder programs, community programs that affect youth. So really all over the board, to include services for those who are bilingual or speak other languages. So lots of jobs out there in these areas. So take a look at some of those titles. We will go back and revisit some of those titles as well. So some of those responsibilities that they talked about in here, but I'm going to scroll down to the salary and see how much. So the median wage is about $22 an hour across the United States. I'm going to look in my state where I am, so you can definitely look per state and see generally in the state that you live in what the salary would be. And it looks about the same, about $22.55 up to $36.99 an hour, and across the board up to $34 an hour for certain areas in need. So median, it looks like anywhere from $23 an hour, depending on location. And for those of you who may have had adult daycare service experience or daycare working with elderly, home attendant, home aide, or something like that, or a care attendant, this could definitely be a job that you could consider working as a community health worker. Those of you who have experience can expect to make $25 to $35 an hour. So really keep that in mind. You could be doing this for a family member. You could have done this as a volunteer in your spare time. Knowing what this is like or having this involved as part of your life could really lead to a job as a community health worker. There are lots of resources out there for you to learn about community health work. So let's look at some of those other job titles, as I mentioned earlier. All right, here are some of those titles. We actually have one here that's a patient navigator, somebody who maybe has experience. Look at that salary there. That is a great work from home salary. A care navigator in a telepsychiatry center, so that's going to be remote. We have virtual clinical assistant and patient navigators. So lots of jobs called navigators. We're going to also look for a remote community health worker. And again, you see jobs there, community health worker, United Health Group, community health worker, 100 or more with community health worker jobs here. So if this sounds like something for you, this definitely could be something you could get into. Again, you don't necessarily need it's not about degrees, but if you do have experience working in this area, you could certainly be paid even more. Maybe you're working for a healthcare group. Maybe you are working for an organization that really needs someone. $1,000 sign-on bonus. So we're really trying to fill in that gap right now, especially right now. This looks about right, 18, 19.50 an hour to start for those. And this one particularly says on site. So make sure you're looking at ones. They may have them in clinic, as we saw in the video, where you're working directly with the community and public. It may be one-on-one. It may be virtual, as we saw with some of the others. So definitely keep in mind, remote customer service rep / community health worker. This one is $17 to $20 an hour, as you see there. So really consider this type of job. I will be putting the link in the comments to the video that I played. I also will putting link in the comments to certain types of jobs, and I will be putting the link in the comments to ONET. As we see here, it does say community health worker on this ONET website is a bright outlook occupation. Bright outlook occupations are expected to grow faster than average through 2021 to 2031. More than 100,000 jobs out there, everyone. So keep in mind, this is a Bureau of Labor Statistics. You could be making anywhere from $23 up to $35 an hour for those of you who already have some sort of knowledge in working with the community, working with a religious group, working with a community group, working with a certain group to gather certain needs, transportation, food services, any types of resources that your organization may work with. So once you get training at your organization and you gather those resources, you'll be learning more and more to help those in your community. So hopefully this community health worker is something that you're interested in looking into. We really do need community health workers out there to bridge the gap. They really do trust people in helping them with the resources or really getting resources that a lot of doctors and medical staff don't have the time to actually sit down and do because they're doing that clinical care. You can take that time and attention to get food resources, diabetes, medication, care, translating, all of those services together could really help multiple communities out there. So hopefully you've learned something about the community health worker today, and this is a job or a career that you could consider. Thanks everyone for watching my videos. It is very exciting to see that I've gotten over 7,000 subscribers. I thank every single last one of you very much for commenting, liking, and subscribing. Please be sure to hit that notification bell because it really does help my videos. That being said, thank you everyone and take care.